You learn about it in school growing up in the history books, and you really don't think, it could happen.
These days right now, these next few weeks are critical.
We're not going to be reopening schools before May 20th.
We have an unforgivable under-resourcing of personal protective equipment in nursing homes.
I had 5 employees, and since the pandemic happened, I actually had to lay off basically all of them.
Right now, we're not paying our bills because we really have no way to do it.
People are hurting, and people really don't know what to do right now.
Every day I wake up and I ask myself, what else can I do to keep my people, their families, my community, and my customers safe?
There are great examples of things to be encouraged about.
The local businesses have gone out of their way to help and support us daily. Our community has been phenomenal in supporting this entire hospital.
Everybody needs them. It's recommended that everybody have them if they need to go out of the house.
Put your heart out. Do what you're doing. We couldn't ask for more if we tried. And you invigorate us every day of our lives.
Live from WFSB, this is a special edition of Face the State with Dennis House. Coronavirus in Connecticut.
Good evening, everyone, and thanks for joining us. I'm Dennis House. Welcome to this special Thursday night live edition of Face the State. Tonight, we are spending time with the governor, who's addressing your concerns. We've received hundreds of emails and questions on the topics important to you and how your lives have changed dramatically since this coronavirus arrived in Connecticut. Governor Ned Lamont is here with us to answer your questions. He's joining us now remotely as we practice safe social distancing. He's at his executive residence tonight in a brand new sort of makeshift studio for this coronavirus crisis. Governor Lamont, thanks for being with us here tonight.
First time we use this one. Hi, Dennis.
Well, it looks great, and we're so glad that we have you with us tonight. And I want to ask you, first of all, because so many people come up to me and say, are we beating this coronavirus thing? Are we flattening the curve?
Yes, we really are. Thanks to you. Thanks to people taking the social distancing seriously. We had our lowest hospitalization rate in Fairfield County in weeks. That's a good indicator that the curve is flattening. Social distancing is working. New Haven is not going up nearly as fast. Hartford, unfortunately, is still going up pretty fast. So we're not out of the woods, but showing real strict discipline when it comes to social distancing makes a big difference.
I want to get into these many viewer questions that we have. We have 2 similar questions, one from Mary, the other from Henna. And the first one says, if the governor is going to supply masks, is the governor going to supply masks when he mandates wearing them? Ordinary people cannot buy masks anywhere. And a similar question from Henna. There are no masks available for purchase everywhere and anywhere. My husband and I both have underlying medical conditions. So where can we get these masks? Governor?
Well, what a lot of people are doing is if they can't find a mask, if their employer doesn't provide a mask, if they can't get one from a friend, there are a lot of folks sewing and making them now. Use a scarf, use a bandana. They'll keep you safe, and more importantly, keep you safer, I should say, and more importantly, keep everybody around you safer. So I think until we get all of the face masks that we need, and we're scouring the globe, we're getting more and more, we're getting them out to hospitals, although they get most of their own gear, getting them out to nursing homes, getting them out to first responders. We're gonna get that done. But in the meantime, be careful and cover your face with a scarf if you can't find a mask.
And this one here from Joe, he says, if there is a mandatory order to wear these masks in public, are you prepared for the possibility of an increase in robberies, armed robberies, and shoplifting?
Why is that? Because everybody looks like a burglar or something now?
Well, I know some businesses
I don't quite understand what that... I hadn't thought about that in a bank. If they're not allowed in a bank, well, you're not going to the bank, you're going to the ATM right now. Nobody's interfacing inside anyway. I'll tell you the good news, Dennis, is that crime in general is down dramatically. I don't know whether the bad guys are quarantining themselves or what it is. I can tell you auto accidents are down dramatically for reasons that we understand.
So this next question is from Cheryl Wasick. How can we have a clear picture and subsequent plan in dealing with COVID-19 when only roughly 1% of Connecticut's population has been tested to date? Countless people are sick and will never receive a test, including myself. How do you account for such widespread lack of testing, and how can you assure that no further surge of cases without adequate testing?
Well, the federal government was caught a little flat-footed and did not have the testing apparatus that we needed. You know, we started out just doing 20 tests a day in our own lab. Now we're up to several thousand, so that's a big plus. We're going to ramp that up again. We got the drive-through testing, CVS, Abbott Labs down in New Haven, down in Stanford over the next few days. So I think you're going to see a dramatic increase in the testing going on. And that's key to us getting on the backside of this virus.
This next question is from Carolyn Carrington. Please tell us why we continue to see the number of infected rising. However, no one is talking about the number of survivors being released from hospitals.
We have started releasing that information, but that's a really good question because when we give you hospitalizations, that's the number of people in the hospital beds themselves. It doesn't reflect the number of people being admitted and, more importantly, the number of people being discharged. And it's worth remembering that, you know, for people under the age of 50, 99+% of people just stay at home, treat it like the flu, quarantine for 14 days. You know, you'll be in pretty good shape. It's the folks who are elderly who are the most severely impacted. That's who we worry about. That's the most vulnerable. Those are the people who really have to stay at home.
We have this question from Anna Thompson. Why is the state paying for hospitals to get PPE? I don't understand this. Why is it falling onto taxpayer dollars, is her question.
You know, right now we're all in it together, and there's such an incredible load upon our hospitals that they couldn't keep up. And if they couldn't keep up, then there'd be fewer nurses who had the protective gear that they needed. So we did our part to try and get them some PPE as we could, to make sure our first line responders, make sure our nurses could go in and take care of you so that they were safe and that so you were safe.
Governor, we're going to take a brief timeout. We'll be back with more with Governor Lamont in just a moment. About 2 minutes to talk about unemployment, when the kids might go back to school, and essential businesses. But first, some fast facts about masks from the Centers for Disease Control.